MRI of the lumbar spine is a pretty common test ordered for low back and leg pain. So here's a video to go over some of the basic anatomy of the lumbar spine. I will also point out what I believe to be the most important structures and spaces of the lumbar spine. So here in the video, you can see a skeleton facing us. So this is technically the right side, this is the left side. So the way the MRI is oriented on the screen is exactly how the patient is positioned. They are placed on their back and slipped inside the tube. So the general view here is as follows. So you can see as the spine kind of turns up this way, this is the general view of the MRI. So as I go into some of the actual images here, I've labeled the right side and the left side. In this particular level, we are at the T12 L1 junction. As I move a little bit further down here, I've labeled the anterior aspect of the spine. So again, this is the front. The facet joints are these structures right here. These are weight-bearing structures similar to the vertebral disc. But the facet joint, to me, they look like hamburgers, meaning that this is the bun, this is the patty, this is the bun. Again, bun, patty, and bun. Just ahead of the facet joints are the nerve roots, which are these grayish structures right about here. And they sit within the spinal canal. And all of this white stuff that is floating within is spinal fluid. Now, these nerve roots will all exit through the foramen. So this is the left foramen, this is the right foramen. Now, the way that I typically view the spinal canal and foramen is it's almost like a highway. So again, you have to almost kind of picture how you're viewing the patient. They're on their back and you're looking through their feet up until their head. So again, using this kind of highway analogy, the nerve roots will travel through the highway and then will exit through the foramen or these exit ramps. So this is the left, this is the right. So I'm going to keep kind of scrolling down here, just again. So now we're moving towards the feet, towards the L1, L2, the T12 L1 level. As we move further down, we're now at the L1, L2 level. So I'll kind of keep going down here a little bit further. You get down to L2, L3. Again, spinal canal, nerve roots, foramen. Now, the facet joints here, again, they start to look a little bit different. This dark structure here is kind of the thickening of the joint capsule in addition to the ligamentum flavum. And so I kind of want you to pay attention to the shape of these joints because they do make a difference sometimes. Typically, at least in my opinion, facet joints are a very common cause of low back pain. Again, as weight-bearing structures, they have joint fluid, they have capsules, they have pain receptors, and they typically cause symptoms when people are going into extension, rotation, or anytime they're moving through transition, meaning like sitting to standing, standing to sitting. But realistically, these joints can just generally be painful. I'm going to keep traveling down here. So we're now at the L3-4 level. A little bit further down, L4-5 level. Now, what is kind of interesting about this here is, again, you can see these facet joints, but you see this white line right through here. This is a fluid signal or a T2 signal. And facet joints are like typical joints. They do have joint fluid inside of them, but sometimes when there is increased pressure, it also will produce increased fluid. And this increased T2 signal by itself doesn't necessarily mean anything good or bad, but it is sometimes a clue that there is increased pressure and potential loading within these joints. I'm going to move a little bit further down we're now at the final lumbar level, the L5-S1 disc. and then we'll finally end at the sacrum. So the sacrum is the triangle shaped bone at the base of the lumbar spine. It's sits between the ilium, and it is a key structure of the axial spine. Now, again, this grayish structure here, this is actually the right S1 nerve root and the left S1 nerve root. For the remaining of parts of the video, I am going to kind of circle back, going from the sacrum up to T12L1. And all I really want you to do is focus on the foramen, the spinal canal. The spinal canal, again, is like a highway, okay? So down here at the sacrum, or the sacral hiatus, you can see how nice and wide this area is. But as I start to circle back, I start to get back into the L5S1 area. This area right through here should be kind of a circle to an oval, but the shape of the canal can change with time and sometimes can be a potential cause for symptoms. So as you start to kind of circle back up, we're now in the L5S1 level. So again, it's still fairly wide open, as you can see here, but you can also see that the general shape of the canal is starting to change. And it is typically a combination of factors. You know, again, if you think of the disc as a cushion, discs and cushions will start to flatten with time, and that can put increased pressure on the facet joints. And then as a result, the joints will become bonier, the ligaments will also become thicker. So you can see, again, the facet joints right about here, but this dark structure here, this thickening can narrow the canal. So it starts to take almost like a triangular shape. You kind of see that as I start to move further up, it's kind of a different type of changing here where, again, there's less triangle, but you can see the shape of the disc can also affect the canal. So as I'm moving it a little bit further up, you can see it starts to get a little bit flatter right about here. And so the canal, again, takes a different shape, but again, overall, pretty good diameter. I'm going to keep moving a little bit further up the spine. Again, you can kind of see the triangle shape starting to form here. It starts to open up again, nice and circular. And then we're starting to get towards the upper lumbar segments. You can see this is the T12L1 level. You can see the rib articulations right about here. But look how nice and wide it is generally in the center. So I'm kind of going to go back and forth here just so you can kind of see the shape, how it changes. It goes from nice and wide to a little bit triangulated and then but nice and wide again. So I wanted to just create this video since MRIs are super common, and this particular MRI, the patient really had no symptoms, to be honest. They might have had some back pain, but structurally speaking, there's nothing significant in terms of a nerve getting pinched or a big disc herniation. But this is a pretty good MRI in that it does show some of the normal changes of the spine. Thanks again for listening.